Imagine going to the hospital during an emergency because you are experiencing unbearable pain. However, instead of focusing on your health, you are worried about how to explain your symptoms to healthcare givers because you can't speak English fluently. This problem might sound unfamiliar to you, but for millions of individuals with limited English proficiency in the United States, this is a common experience during medical appointments. Language barriers remain a significant challenge in the U.S. healthcare system. Individuals with limited English proficiency, or LEP, are people whose primary language is not English and who may struggle with writing, speaking, understanding, or listening in English. According to the U.S. Census Bureau in 2024, patients with limited English proficiency or non-English language preference were estimated to make up approximately 10 to 15% of the U.S. population, which consists of approximately 25 to 35 million people. When patients cannot communicate efficiently with healthcare providers, they face serious obstacles in accessing safe and effective medical care compared to their counterparts who speak English fluently. In addition, healthcare providers are also affected by the effects of miscommunication, increasing the risk of misdiagnosis and misunderstandings about a patient's symptoms. To address this issue, the U.S. healthcare institutions should strengthen the implementation of the National Standards for Culturally and Linguistically Appropriate Services, also known as CLAS. This can be achieved by implementing mandatory cultural competency training for healthcare providers and by allocating the appropriate resources needed to provide respectful linguistic and cultural services that adapt to the communication needs of different communities. Navigating the U.S. healthcare system remains a persistent challenge for individuals with limited English proficiency, or LEP. Although legal regulations exist, language barriers continue to make medical care less accessible and safe for many people in the United States population. One of the most important legal protections is Title VI of the Civil Rights Act of 1964, which prohibits discrimination based on race, color, or national origin in programs or activities that receive federal financial assistance, according to the United States Department of Health and Human Services. As a result, because this law requires healthcare organizations to provide language access services, the U.S. healthcare system has implemented several strategies to improve healthcare access and communication between individuals with English proficiency and healthcare providers. These strategies include access to multilingual materials, free professional interpreter services, and the National Standards for Culturally and Linguistically Appropriate Services, also known as CLAS, introduced in 2001 by the Office of Minority Health in the U.S. Department of Health and Human Services. The national CLAS standards consist of a set of 15 actions, steps intended to guide healthcare institutions to implement appropriate cultural and linguistic services for individuals with limited English proficiency. Throughout regular assessment of language services, improvement of internal organization, incorporation of community needs, and the provision of training materials, healthcare providers can better understand the beliefs, values, and backgrounds that shape the cultural and linguistic needs of the diverse communities they serve. However, despite these efforts, many of these services fail to fully overcome language barriers due to inconsistency, limited resources to train healthcare providers, and misalignment with cultural and linguistic expectations. For example, a cross-sectional study of more than 500 hospitals in the United States across 17 states found that only 11% of these hospitals offered patients portals in 3 or more languages, with the majority providing access only in English and Spanish. Similarly, research found that only 13% of hospitals fully meet all 4 language-related CLAS standards, while 19% fail to meet any of them. As a result, patients with limited English proficiency report less use of healthcare and more barriers when navigating the healthcare system in the United States compared to English-proficient speakers. According to a 2023 survey on racism, discrimination, and health, about 33% of adults with limited English proficiency in the U.S. are uninsured compared to their English-proficient counterparts that reported to represent 7%. Additionally, 24% of adults with limited English proficiency reported to not have a usual source of care, which is twice as high as the 12% result of English-proficient speakers. Additionally, the same survey reported the following challenges for patients with limited English proficiency seeking health care. About 34% have struggled to fill out forms for a doctor or healthcare provider, 33% struggled to communicate with office staff at a doctor's office or clinic, 30% found it difficult to understand instructions given to you by a doctor or healthcare provider, 27% struggled to fill a prescription or understand how to use it, and 25% struggled to schedule a medical appointment. To address these challenges and make healthcare more inclusive and accessible for all individuals in the United States, healthcare institutions should allocate resources, hire qualifying personnel, and regularly assess the effectiveness of the implementation of the National Standards for Culturally and Linguistically Appropriate Services, also known as CLAS. One way to achieve this is through mandatory training programs for healthcare professionals. These programs would focus on cultural competence, recognizing patients' body language, awareness of language access services, and implementing clear and simplified language when explaining medical information without compromising the accuracy of medical terminology. Straightening CLAS cultural competency training programs would benefit both patients and healthcare professionals. Overall, it will improve communication. Patients with limited English proficiency will be able to describe their symptoms, which will lead to higher patient satisfaction, increasing use of preventative care, greater effectiveness of treatment plans, because patients will better understand medical instructions. For healthcare providers, better communication can improve the accuracy of patient data collection, help their patients make decisions about their medical conditions, reduce the likelihood of misdiagnosis, and reduce potential legal risks associated with medical misunderstanding. Some critics may argue that healthcare institutions already provide enough language access services and that implementing mandatory training programs would be expensive and time-consuming for healthcare professionals. However, many of these services currently implemented, as previously mentioned, are inconsistent, and millions of individuals continue to face problems when navigating the healthcare system. Considering that individuals with limited English proficiency make up approximately 10% to 15% of the U.S. population, it's essential that health institutions start to provide effective resources and training to healthcare professionals so they can provide an inclusive and quality service to everyone in this country.